Hi, my name is Farrah Nicholas. I'm doing my IM injection video today. So before going into my patient's room, I'm going to check the MAR with the doctor's orders. So I have my doctor's orders right here. Haldol 2 milligrams IM every 6 hours PRN. So compare that to the MAR, make sure everything matches up and it hasn't been given within that time period. Once everything is good, I'm going to enter the patient's room, identify the patient. That's my first check, and then also make sure that I perform hand hygiene and put on my clean gloves. Once I do that, I'm going to perform a focused assessment. So since I'm giving Haldol, I'm going to check respirations, heart rate, and blood pressure. Once I've checked all three of those things and everything is within normal limits, I'm going to then draw up my medication. Prior to drawing up my medication, I'm going to check it with the MAR. Again, make sure my vial matches the MAR. And for my vial here, it says 1 milligram per milliliter. I need 2 milligrams, so I'm going to drop 2 milliliters. I have a 3 gauge needle, and 3 milliliter syringe and a 23 gauge needle. So I'm going to start by cleaning off the top of the vial and opening this, setting this like that, and pulling up 2 milliliters of air. Inject this, inject the air, and then flip it. And then kind of let it start on its own so it doesn't form any air bubbles. And once I see that it's good, no air bubbles are present, I'm going to start pulling to help speed the process up a bit. 2 milliliters. Okay. Then I'm going to recap. Just like that. Ooh. If I can get it, there you go. Recap, click it, and then remove this. Get my new needle, open this, and then screw it on. Okay. So once I've done that, if I was outside the room, then I would have labeled this, but I'm not, I'm in the room, so I'm good. Once I've done that, I'm gonna identify my patient again. Ask for name, date of birth, check the wristband, and then that was my third check. Once I've done that, I am going to use a deltoid muscle. So I'm going 3 finger widths down and then using Z-track method. So I'm gonna go just like this, move it over, clean in a circular motion with alcohol swab. Without moving my hand here, I'm gonna uncap that, go in at 90 degrees, boom. Aspirate, so pull up, boom. Once I see no blood, I'm going to inject. Going to inject at 1 milliliter per 10 seconds. So going very slow here. And once I have everything in there, I'm gonna leave it there for 10 seconds. Once it's in there for 10 seconds, I'm going to remove this. Take an alcohol swab, put it on top lightly. No pressing, just set it on top. And once I have done that, I'm going to remove my gloves, perform hand hygiene, and document. And I'm going to discard this. With this glove, since I still have it on, I'm going to discard this in a biohazard bag. I have that like right over here. And then the 4 most common IM sites are the deltoid, vastus lateralis, ventrogluteal, and the dorsal gluteal. So yep, and that's it. I'm gonna get rid of this glove, perform a hand hygiene, and then go document. And that's it.